Father Gustavo, that's what he's called to do, right? He's a priest and a theologian. They're supposed to be hopeful, and that's the message of the gospel. But that doesn't mean I felt that way, and that's some of our coworkers, um, from everywhere, from Partners in Health Boston, and people can lose hope, and people lose hope, especially when they're in dire situations. But anybody can lose hope. So to get it back, even if it's just a question of discipline or commitment or some sort of spiritual or moral exercise, I think that's pretty useful thing. And and plus, Father Gustavo is a very cheerful, hopeful person, and sometimes you need that around you, and cheerful, hopeful people can be a powerful antidote to despair. We even put antidote to despair in our mission statement, which now makes me chuckle, but that was 25 years ago. But it's a good idea. Again, another idea. To give in to despair is to see no hope, and that means you see the end, but we don't really see the end. Some people have met their end, but it's not the right way to approach medicine, certainly, but also service to the poor, to give in to despair. And of course, for people who aren't poor themselves or sick or dying, to give in to despair means to retreat from those problems. And if in other words, if you're not poor or sick or dying, and you say, "Oh, well, I despair that there will ever be a change or that it will get better," you're not the one actually sick or dying or poor, so that's a retreat, and that's a giving in to, it's giving up on behalf of other people, right? So, Father Gustavo and some of his consociates are pretty tough, and to say, you're not allowed to do that. You can't give up. You're not even poor or sick, And look, people who are poor and sick, they're trying. They're not giving up. Powerful, corrective, and that's how I look at it, as a corrective. It's not intellectually shallow to have hope. That's a profound thing, And no historian, sociologist, anthropologist, no one's going to convince me that that's wrong.